Hi, everyone. Welcome to Stimulus Connect, impacting the impact of the pandemic on people who use drugs. I'm going to hand off to Frankie.
Bonjour tout le monde, je m'appelle Frankie Lambert et j'utilise les pronoms il et
Hi,
vous.
everyone. I'm Frankie Lambert and I use they, them pronouns. I work as a communications coordinator for PWUD, which is an organization of people who use drugs in Quebec. So as a racialized person who uses drugs, I live according to principles of harm reduction and transformative justice. And I'm also passionate about decriminalization and activism.
I'm the communication officer at l'Association québécoise de la promotion de la santé des utilisatrices de drogue. It's a provincial organization that brings together people who use drugs and who aspire to promote their health, prevent sexually transmitted and blood-borne infection, improve their living condition. So as a person of color, a drug user, I live by the philosophy of harm reduction, transformative justice, and I also have a passion for decriminalization and activism. I'm now gonna let Sophie introduce herself and simultaneous interpretation in English and French.
I'll start in the English channel. Can you hear me? Okay, so can you just let people know to go on the English channel to hear the English version? All right, so hopefully everyone can hear me. My name's Sophie. I'm based in Tiohtià:ke in Montreal, and I'm going to be doing the interpretation today. So I was going to give some instructions before activating the interpretation, but since it's already started, hopefully you're able to access it. Basically, when someone is speaking in French, just click on English. And you'll be able to hear the interpretation in French. Because we're alternating between English and French, you might want to deactivate the interpretation to hear the presentation in the original language. I see there are some people who are saying they can't hear me. So I think we're sharing the instructions also in written form. Sorry about the confusion, but hopefully we'll be good to go. Everyone is welcome to ask questions in either English or French, and we'll be sure to make sure that everyone understands before we move forward. So now I'm going to switch over to the French side and do the same thing in French so we can give it a try in that way. Frankie, could you let people know to try the French channel? Okay, no one can hear me.
Merci Sophie. Donc, je veux souhaiter la bienvenue à tous nos invités internationaux.
I want to welcome our international guests and start by explaining what a territorial recognition is. So this is an opportunity to recognize the presence of Indigenous people on Canadian lands and in other contexts as well. It usually happens at the start of a meeting or an event, and it's a way to recognize the history of colonialism and the need to change and move towards decolonization. So it's a just and an equitable way to recognize the territories of Indigenous and First Nations. It's an important step to honor the first occupants of a site and of a territory. So I would like to take the time to recognize the Ghanaian-Gehaga Nation, who is a keeper of the lands and the waters where I live. Tiohtià:ke, which is now known as Montreal, is for long been known as a place of gathering amongst Indigenous people and other groups and communities that reside here. So I would like to thank Indigenous communities for allowing me to be here and who have looked after these territories and waters over the last several centuries. And I thank and I recognize all the other lands where we are located.
Just letting some time for Sophie to translate everything. Are we good to go?
Yeah, we're good.
So now I will let the panelists introduce themselves. First of all, we have Og Feather from BC.
Hi, everybody. My name is Hawk Feather, and my pronouns are they, them, and I'm coming to you from the Sunshine Coast of British Columbia. The community I live in is a rural community, but it's still on the mainland. It's a ferry trip away from Vancouver. And yeah, I'm very honored to be coming to you from the lands of the Coast Salish people. And it's the Seashell Nation where I reside. It's a beautiful, beautiful place. And these lands are the unceded, stolen, and occupied territory of the Squamish, Musqueam, and Tsleil-Waututh people. And I have a lot of humble gratitude for being here. I'm happy to be here. Thank you for having me.
And now we have Kyle from Thunder Bay, Ontario.
My name is Kyle Arnold. I'm coming to you from Thunder Bay, Ontario, northwestern Ontario, a small community, about 100,000 people. I'm an outreach worker here in the harm reduction field. Thanks.
Thank you, Kyle. And finally, Rosie from Quebec.
Hi everyone, my name is Rosalie and I'm a sex worker from the island of Montreal, and I have been in the industry for the past 5 years, and I worked in a brothel and agency and as an independent worker across Quebec.
Thank you. So we have a few planning committee members who are helping in the background. Will give us a wave. So we have Savannah from the Dr. Peter Center. We will be watching the Q&A. Sanjana from the Canadian Student for Sensible Drug Policy, who is watching the chat. Shay, the Stimulus Program Coordinator, who's doing background tech. And now we can finally start. So, bienvenue à tous. Hello, everyone. Donc, 3 mots.
Welcome, everyone. So 3 words to keep in mind as we move forward: patience, kindness, and humor. We've been getting together in new ways, of course, with COVID, on internet, with new technologies. There's always risks and instability and possibility for error. So let's create a space where we can all be authentic. So I encourage you to introduce yourself by using the chat function. We have 76 people along the line joining us today, so this is fantastic.
So just a little bit of housekeeping. We are using the hashtag Stimulus Connect. Question for panelists go in the Q&A, which Savannah and I will be watching. You can upvote them. Sanjana and Shay can help you with any technical issue, and Sanjana is monitoring the chat. This event is being recorded and it will be available on the Stimulus website in the next day or so. If it all goes well, it's going to be on the Facebook Live right now. I believe it is. Yes, it is. The Stimulus Connect website has 65 resources thus far. And we identify more today, and we will, if we identify more today, we will add in the website. So you can add some links in the chat if you want. And we welcome questions in either French and English. So thank you to the Canadians who use drug and that continue to live through the pandemic. And I've been involved in bringing the Stimulus Connect today. Donc, qu'est-ce que le Stimulus Connect? Le Stimulus Connect, c'est un webinaire.
So what is Stimulus Connect? Well, it's a webinar that allows people who work in frontline service provision, who work or live around harm reduction and drug policies to get together and talk about the issues that affect us all.
So I would like to talk with Og Feder. If you could please tell us about the BC Drug User Liberation Front. And I believe you have an event going on April 14th.
Yeah, we do. DULF, it's www.dulf.ca, dulf.ca. It's an organization, well, a group that kind of came from the absolute unyielding frustration that most of us have as drug users to see what a lot of us consider complete inaction by our government to actually address the overdose crisis. So it's the Drug User Liberation Front, and it's really just a bunch of folks that have come together to try to do more. We had one event in the past where we sourced and then gave away for free some cocaine that was free of fentanyl. And we happily did that for an afternoon, and we're able to provide our own community with safe supply, actual safe supply. And on April 14th, we are going to be doing it again. And if you visit the website, our statement is up, and you can happily read what we have written up and shared to the community. And the plan is to hand out heroin and cocaine that are fentanyl free, and to do so for free for people in the community that need access to safe supply. We like to show how easy it is, but for me, I can't speak for everyone, but for me, the message here really is, if you, the government, are going to leave us to die, at least get the fuck out of our way, and we will figure out a way to help ourselves. We've been asking for the same thing since the overdose crisis began, and even before that. It's not complicated. We don't have a massive list of demands. We need decriminalization. We need safe supply. Of course, there's a lot of complexities there, and there's other things, but we know that those two things would save lives. And we know that there's been very little movement in regards to actually implementing either. So yeah, deep frustration, massive amount of grief, and just white hot rage. And it comes together with a really beautiful, resilient, loyal community, which are drug users. And yeah, we just want to come together and take care of ourselves and each other.
Thank you. That's amazing. Someone is asking, what can businesses do to help?
To help the Drug User Liberation Front? You know, there's so much people can do to help. If businesses want to help, I'd say donating is a good way to help. We just source and buy safe supply, and it can get really hard to do that. I'm not speaking on behalf of anyone else here. I'm just a drug user, and DULF is just a group of drug users, but I think donating is a great way to support. I also think that businesses should ensure that they have policies that are safe for substance users, so that they can be employees and, you know, receive benefits, work as union members, and not be under the threat of being discriminated against for being substance users. I think they need to ensure that they have policies so that the workplace is safe for substance users.
That's a really great answer. Thank you. and what the situation has been in BC since COVID.
Yeah, the one thing I like to say when I'm talking about the pandemic in regards to my work and living as a substance user is to point out that the numbers of deaths in British Columbia plateaued just a tiny amount not long before the pandemic began. And we saw health authorities and government representatives really very publicly patting themselves on the back for that plateau. Well, quite a few activists, myself included, went public and went to the media and outright asked for them to stop doing that. People were warned that that could lull our community into a false sense of security and safety, and that any little thing could disrupt our safety. And if you have just told people that the numbers are safe and that the numbers are better and that people are more safe, it puts us at increased risk. So we asked a lot for them to stop applauding themselves for this slight plateau in absolutely disgusting numbers. But sure enough, the pandemic hit right as we had that plateau, and the spike in deaths was pretty immediate and just devastating, just an absolute obliteration of our community. And the one thing I always like to say that the one big thing the pandemic has taught me is that we're being lied to, really. When it comes right down to it, the lack of action has nothing to do with anything other than complacency and a willingness to let us die in the street. We see an infrastructure here that rolled out as quick as a whip to save lives and to actually address a public health emergency. The overdose crisis was declared a public health emergency on April 14th, 5 years ago. I can't think of anything else that's ever been declared an emergency and then just left to linger. Well, very little gets done. Occasionally some money gets thrown at things, but we have a shell ministry in British Columbia. We have community action teams set up with very, very little oversight and very, very little insight as to what the communities actually need to do. And it's left people to die just needlessly and completely preventable. All our services just ground to a halt when the pandemic hit. Very little engagement went into what we should actually do to ensure that drug users were safe. That all sort of came after the fact being massive loss of life. And we saw every little thing that we clawed for to get to protect ourselves suddenly ripped away. So we had safe consumption sites and OPSs just closing, shelters closing, food sources drying up. We had harm reduction supplies became unavailable. Of course, the drug supply was affected. We just lost almost everything, and anything that was available was by drug users that were often going against what they were encouraged to do by their employers. And that's what kept people alive during those early days when we were all completely in lockdown. I saw a lot of people in my community of drug users. They just didn't know that the risk even affected them. They had very little information coming to them that actually was relevant to them. I heard people saying that you couldn't get COVID if you've had Hep C. I heard people saying COVID only affected healthy bodies, so homeless people didn't have to worry. I heard so much misinformation, and I think it was a direct result of just ignorance. People made no effort to actually address the drug user community from the drug user community, or to address them in ways that are relevant to them. And it was devastating. So many lives have been lost. And like I keep saying, it's preventable. Every single death was preventable. And the infrastructure in place to save lives is there when those lives matter to people. And you can see it now. You can see that you can get updates every single day from the authorities that be. You can get money doled out like a flash, and You can get clinics set up and hospitals rearranged and staff introduced and policies changed and language changed and huge education to the public. But when it comes to drug users, just nothing, right? We haven't really done much to prevent overdose. In BC, we rolled out naloxone, but we don't even really look to the effects of naloxone on a long-term basis. We aren't trying to stop people from overdosing or keep them safe. We're just giving them a Band-Aid for after they overdose, and not really paying much heed or mind to how that actually impacts bodies or souls or spirits. And, I'm just so enraged when I look at the successful campaign to address COVID in British Columbia. We had daily updates. We have, our physicians groups rallying and creating these really phenomenal community, little pockets of groups with nurses and service providers. And I just don't get where that was for us when our emergency was declared. I'm just seeing complacency, and the pandemic really just highlighted all of the things that have frustrated me. Really, it's been brutal. At one point, outreach workers were told not to give rescue breaths to overdose victims. And that just tells me, that potential staff member, their lives are more valuable. Even just the potential risk of harm from COVID mattered more than the immediate and absolute risk of overdose death. And, one was a potential, one was a true reality. And it was clear which life mattered more. You couldn't have a more clear statement from our government telling people not to give rescue breaths. We saw some funds dished out for all of the frontline workers that had to keep working during COVID. Didn't go to many peers because most of us aren't considered real workers, we're contractors. So, that hazard type pay that went out to all the frontline staff, very few people I know actually received it that do frontline work. I know people that had MCFD called on them because they kept doing outreach during the pandemic. I know people that, were denied medication. They at least rolled out safe supply as a response to the pandemic in British Columbia, but they rolled it out poorly. Not a lot of education went into actually teaching our doctors how to prescribe and how to engage with patients in a way that's not discriminatory or stigmatizing. And so we didn't see it in the way that drug users have been asking. And I don't even really call it safe supply. To me, it's more replacement therapy. It's more like alternatives, right? To me, safe supply is a safe supply of the drugs you're already doing. We didn't really see that, but yeah, that's where we're at, right? We're at devastating loss and a clear infrastructure to have prevented it. That's me in BC.
Thank you so much. I think you've raised a really good point when you mention, what we can do when we consider that the lives matter, with all, like you were saying, all the works that went into preventing COVID compared to preventing overdose. So yes, thank you so much. We're now gonna end over to Kyle. If you could please tell me, how's the impact of social media on people who use drug in Thunder Bay?
Hi. The impact of social media, I believe, in Thunder Bay's, it's huge. It's let the people, that are incarcerated, that are homeless, that their lives don't matter. It's that was in the social media about letting the people in the prisons die, that their lives didn't matter if they got COVID. people weren't impressed with the fact that when the rollout came for the vaccination, that the homeless people were getting it first because of their vulnerable, because they are vulnerable, because they are homeless, their immune systems, you know. So we've seen it really hit Thunder Bay, and you know, the people that are using drugs, the people that are vulnerable and homeless, they read this, right? And it goes on to, you know, it pushes them farther and farther away from mainstream society and finding any acceptance in mainstream society.
Right. And how has been the impact of COVID on your community?
It has, it's become a hotspot here, right, for COVID. And unfortunately, you know, Hawkfeather really talked about some things that I can really relate to. And that is the updates every day for COVID are there, like every single day. But there's nothing for the overdoses. There's nothing letting people know, you know, about the addicts. And, you know, they're being put into hotels or pushed here and there if they get COVID. But where's the harm reduction for the addict that goes into a hotel? Where, you know, where why do they have to be dope sick while they're sitting in that hotel? And I feel like there's been such an eye on the COVID that it's pushed all eyes away from the other epidemic, and that is the overdoses. You know, Thunder Bay is such a small community where they don't allow tent cities here. They don't allow people to live freely on, you know, on the land. That's not okay. They're arrested. Their tents are taken down. They're herded into different shelters, and they have no choice of it. And we're seeing it more and more, just the lack of support that is out there for the people that use drugs, for our vulnerable population. Also coming from a small community where it is not okay in this community to use drugs. All over social media, people want to post videos nonstop of this person in this state, and you know, they want to drive down the roads where the people are working the streets, and they want to take pictures and blast them on Facebook. And it's just a continual thing here. It's just shaming people for the way that they're choosing to live their lives. And it's truly sad to watch. For me, I've been on both sides. I was a drug user for 20 years. And when I lived in the larger cities like Victoria, Vancouver, I had so much more support within the community and within, the community, and just acceptance for my choices because they're my choices. Whereas here, everybody believes that you shouldn't have the choice. It feels, you know, when I go out there, they look down on these drug users. They look down on the street workers, that they shouldn't have a choice. And it's been truly sad to watch. And as I said before, the focus, you know, there may have been a brief focus on the overdose epidemic, but as soon as COVID came, that was swept under a rug. You know, and Hawkfeather mentioned it so much. You know, they'll change hospitals around. They'll come up with all this money and resources and train new people in new positions to fight the battle against COVID. But what happened to the battle that's been going on for 5 years against overdoses? Where's that battle gone? You know, where are the treatment centers if people want to go that way, or the detoxes, or where's just the safe housing that people can live in if they choose to use drugs? Where is the human right to meet people where they're at?
Thank you, Kylan. Can you remind me what organization you're from, and maybe talk a little bit more about it?
I work for Norwest Community Health Center. We have one of the safe injection sites downstairs in our location. I work as a harm reduction outreach worker. So we help everybody with from harm reduction supplies to food, to finding them different resources for housing. If they choose to go down the treatment and that road, we help them there, or we just meet them where they're at, whatever they choose. We're open to pick up that phone and to be there for them, no matter what the circumcision, the circumstance is. We don't judge. We just try to meet people where they're at.
Thank you so much, Kyle. And finally, and not the least, Rosalie, if you could please tell me, quel est l'impact de la pandémie sur les travailleurs?
Rosalie, can you tell me a little bit more about the impact of the pandemic on sex workers in Quebec and in Montreal?
Thanks, Frankie. Well, I want to start first by saying that while I'm a sex worker, I still do have some privileges. Like I'm white, I'm not trans, and I'm not a drug user. I'm a next drug user, but I don't use at the moment. And the more you experience intersections, the more you might experience violence in this industry. So it's important to keep in mind that my experience might not reflect the whole community because we're not just one homogenic group. So I'm just gonna start off by saying that it has not been really easy. At first it was okay. It's still, sex workers are just as anybody else, and we can be anxious about the disease. And some sex workers are sex workers because of their health condition, mental health condition. So when you can't work, you might be more at risk of being in a bad situation, because I know that I did not qualify to get the Canada emergency response benefit. I did not qualify, so I could not get any economic support from the government, and that was pretty hard. But at first it was fine, because a lot of other workers, it's a competitive place, especially in Montreal, as we usually are 3,000 worker in a year on the island. It was great at first when people were confined, in like May and June, because people were alone. So when people are alone, they might want some company. People bought a lot of alcohol, and people had some money because of the emergency response benefit, So what I did, because I used to work at night, so I switched to work in the day. And all along, I just want to mention that yes, there is a real stress coming from the possibility of getting tickets, because in Quebec you can be fined. Since the start of the pandemic, we could be fined. At first it was like $600. Today it's the most is like 6,000. So when you don't even have money, and that's why I was working, because I was not getting money from the government. I had to keep working, and if you get a ticket, it's like you work for nothing. And we were not taken in consideration by the Quebec government or the Canadian government at all. This summer though, it was okay. Not as usual, not like most summers that I experienced in the past. And you always feel like you're gambling with your health, and it's stressful because you could be a threat to your family, to your friends, and you can't stop seeing people that you don't know, and you can ask them like, who did you see? did you get COVID? We don't have all the privilege to ask those questions to the people we see. So it was, that's stressful. It's tough on your mental health in the long run, I guess. And I also went outside of Montreal to see if it was a little better. In the industry, we have what we call in calls and out calls. In calls is when the clients come to you. Out calls is when you go to them. In Montreal, I only do out calls. And when I went in the north of Quebec, I wanted to do out calls because I didn't have a lot of budget, so I didn't want to rent a hotel room because I thought it could be like a little suspicious with the context of the pandemic. But it was not really, not worth it, I guess, because families are confined together, and that's the kind of thing that we deal with. Dads have kids and dads are clients, husbands are our clients. That's the reality that we have to, people have jobs and families, and it's harder for them to be able to see someone else in this context without it being known. And to get a hotel room, it's expensive, and Airbnb is not accepting sex worker as many other platforms such as Facebook, PayPal. It can be like a real threat that they can shut down your account, and with PayPal, yes, with money in it. And with those things, you always have like a stress that you can be like, that people might call the police. So that's stressful a lot. At the end of the summer, when school started, it's always a little slow because I guess having kids might be a little expensive and people start school. So it's really we really have like a little plateau of, it was just a lot slower than usually it's slow. And Quebec decided to close the bars. So the reality of it is, when people don't drink as much, we do get a less client as people who consume drugs and alcohol might make a more impulsive decision, and a lot of them don't like being alone at the end of the night, so we're usually the one to be called to spend just a little time and to talk a lot. November is always slow, but this year it was horrible. December it was good, comparing to the fall that we had. It's usually extremely lucrative to work in December. People are joyful. People get money from gifts. People want to spend sometimes with other people. They don't want to be alone. They want to have a date, and yeah. But it was slower this year for sure, because I guess people had a little less money as the emergency response benefit ceased for a lot of people, and the economy did not actually restart for everyone. So it was slow, and I was kind of counting on the exceptional solitude of people, as Christmas was pretty much canceled in Quebec. So, and yeah, it I guess it happened a little, but it was something. It was just a little tough. And then January, the start of the month was better than usual, because I guess when it was slower in December, then it just keep continuing, and in January, so it was nice. But the Quebec government decided to impose a curfew that we are still experiencing. So that was really, really hard, actually. It still is. I tried to switch back today again, because I switched back tonight when the people were not still confined. And it was just, I was losing more money waiting for calls than I would be doing something else. And it was, and I talked to a lot of other people, other sex workers, and it just ruined careers, though. They don't see clients because they can see them at night, and people work in the day, and it's just, everything's at risk. And with the curfew, you can have like a paper that your boss can write in it, saying that you are essential to the job that you're doing, so you can go outside when the curfew is in place. But we don't have bosses and stuff, so who does that? And yeah, still to this day, nobody talk about a vaccine for sex workers, because we had vaccines here for homeless people, and it's really essential, because the situation was and is still it's still pretty tough. But we are not getting any health response from the government, but we have to keep working because we don't get financial help. So I'm feeling a little like we're getting mixed response from them, like if our job was just not a real job, although some organisms do recognize it as a real job. So it's tough. So when the curfew was instigated, I decided to try and find like what we call a real job, I guess, in quotation mark. But I have like a 5-year gap in my curriculum, so I had to make something up. So it was pretty hard. And the thing with curfew and the thing with COVID that I talked in an interview that I sent the link to Shay, that I did it in French though, and with a journalist, is that the more that we are at risk, like we are, the more that clients can and might try to be violent, that might try to go further or push limits. And when you know that you're not getting a lot of money, and some of us are moms, some of us have mouths to feed, we have families, we have bills to pay. Some sex workers might push their own limits for a little more money, but it's still tough on your mental and physical health, and you take more risk, and there's real risk implied in our jobs, sexual transmitted disease and etc. That's a real thing that we do talk in our communities. So yeah, there's an organism that give like the only one that did is it's called Stella in Montreal. They give about like $100 for each person, but you know, it's about like a bill. I don't know, a phone bill, internet bill. So it's not a lot. And as I said, I'm not, I don't have kids. I just have cats, but I'm not a drug user, and I don't have some responsibilities that other people might have. And it's $100, $100 is not a lot. And some people got 2,000. And I didn't qualify, and I know I'm not the only one. Yeah, so there's that. And yeah, still we are, you know, still fighting the government to change the laws that are in place, what we call the Nordic model from the bill C-36 that decriminalize the sale of your own sexual services, but third parties and clients are criminalized. And it's making it tough because you are never safe this way. I think you're less safe than if if we were criminalized, I guess, as clients too, as clients are when we sell. Because now, you know, police officers might act as sex workers, but not, and you know, some clients are and did get caught, and that's what clients are scared of, and they might get violent. And when you're anxious, you're more prone to impulse reaction. So it's just making it all tough overall. Yeah, in the article that I participated in, the Sandra, the director of Stella, the organism that I mentioned in Montreal, some workers, you know, went in another field for the time of the pandemic. But when you have like worse conditions and a worse salary than when you're a sex worker, is it worth it? You know? And yeah, it's pretty tough when you work for yourself and your own boss. You know, you decide of your schedule and your salary pretty much. So yeah.
Thank you so much. That was really informative. I think it's now time for us to take questions. So I will now look in the Q&A. We already have a first question. Oh, we have a couple questions. That's great. Keep them going. So I would like to ask all the panelists to please open your camera so we can see you. All right. Thank you. We're still missing Feather.
It says that my host has disabled my video.
Oh, okay.
There we go.
Awesome. All right. So, well, let's start with you. Someone would like to know what is the personal impact of the on the pandemic on your well-being, as well as working in harm reduction. How has that impacted your personal life and work to date?
It's kind of complex. I do frontline work as an outreach worker, but then I also do a lot of work as an activist, which is more political, different type of work. And really, the pandemic affects those two different things in two different ways. I found as an outreach worker really stretched. We did have a really fabulous space that was like an open house, drop-in clubhouse kind of for drug users in my community. And unfortunately, we kind of closed it for the pandemic because I found I couldn't keep people safe. they couldn't really distance, they couldn't really, you know, people were coming there to congregate. That was the point. So we closed it and it never opened again. Unfortunately, we kind of lost community support, and it's been pretty devastating for the substance users in our community. Yeah, it's that part was really hard. I found it really hard to weigh protecting my family against protecting my community, because that is my family as well. But I have children and a partner, and none of them consented to being put at increased risk because of my work. A lot of frontline workers I know opted to live separate from their families for months. And I watched that devastate people that are already in a position of being traumatized daily. And I've seen people stretched to their limits. I've been pretty stretched to my limits. I found the process of trying to access safe supply was very humiliating and really disempowering. I don't know if is that even a word. It was. So if it isn't a word, it is now. But it was really challenging. Something that was meant to be a tool to make our lives easier made it more complicated for a lot of people. It meant engaging your care providers and doing it in a way that we're not really used to. We're used to really trying to do the dance of anything but drug seeking. We're trying to always ensure that doctors know we're not drug seeking at all costs. And suddenly you need to go to your doctor and drug seek. And it puts you in a very vulnerable and challenging position. And I did find that my doctor took advantage of that and was very unkind, and it made it a lot harder. So yeah, lots of loneliness, lots of struggling with my priorities. I've felt like I work 7 days a week from about 9 a.m. to about 2 a.m. every single day. I do outreach and the work I'm doing, and I'm not complaining about that because I am so in love with my job. But yeah, it's hard. There's no other way to put it. This has been really, really hard. And yeah, the hardest part I think was weighing my family's safety and needs. I think that was the hardest part for me.
Thank you so much. The next question is for Rosalie. We would like to know, do you feel as though the pandemic brought your community closer together so you can survive?
Hi, thanks. That's a really good question. I guess yes, because we were all of us like struggling. But I think just as Hawkwitter just said, it's tough to be someone that people can lay a head on your shoulder, like when you're also stretched to your limits. But yes, I think that overall, there was a lot of support because a lot of us are kind of out of work right now. And yeah, I guess you could say that there was a little a sense of community into this, I guess. Yeah.
All right, thank you. Now to Kyle, would you be able to tell me how do we improve access to service post-pandemic? Is there anything that the pandemic taught us that we could use later in our advocacy?
I believe the pandemic taught me that if the pandemic fits the public's eyes, there's a lot of resources that are available. I believe that if we put even a quarter of the effort that they've put into this COVID pandemic for the overdose pandemic, I think that we would save countless amounts of lives. And that it showed me that the resources, the finances, the people, they're available, but it only seems to be available for the pandemic that they choose. And that's what it's taught me.
So true. Thank you so much. Another question for Rosalie. Is there a union or a collective for sex work in Quebec? If so, have they been vocal on the impact of the curfew or the need for a vaccine?
Um, I don't know of a union or a collective for this political part of the the sex work industry in Quebec. Like I said, Stella does a lot of political work with the government, both of Quebec and of Canada, to work to to bring awareness to what's happening to us. But the thing here, Rosalie's not my real name, and the reason you don't see my face right now is because it's recorded for evident purposes, for educational purposes. But to be out as a sex worker is incredibly dangerous. You can face a lot of backlash from your friends or family if you have like a sale job. You could lose your job. Also, landlords can be discriminational. Laws are not really perfect about that here. So there's a reason that we can't always come to the front row and talk about those issues. That's why we need allies. But so no, not really, because it's just that would be more dangerous than we are in danger right now. So as I said, Stella is doing is trying to. They work. They have been to Ottawa and stuff, but no, not about a vaccine that I know of. So
Thank you. That makes a lot of sense. From what I understand, it would be hard to offer a vaccine and give essential work paper to sex worker without outing them, if I'm correct. So, is there any other questions in the chat? Well, oh,
I was going
hey.
to say, I have a question, and it's
Oh.
possible the panelists have questions of each other as well, but I have a question, and because I'm in the background, I can't use the Q&A. So if it's okay, I'll just jump in.
Of course.
My question is how has your community have to respond? Some people touched on this a little bit. How has your community had to respond to the random changes in the drug supply?
That's a great question.
I can jump in there if you'd like. I do find in British Columbia, we are blessed and cursed to have the basic epicenter and kind of like the mecca of harm reduction, which is the downtown east side. And I say blessed and cursed because we have all this really progressive, really great information about harm reduction and stuff coming out of the downtown east side in Vancouver. But it's pretty common for people to think that that's the standard across British Columbia. And I live in a rural community. I even share a health authority with the downtown east side, which makes it extra complicated. But I do find that sometimes there's the assumption that all the communities have responded to healthcare needs the way it's responded to in Vancouver. And we really have quite a massive amount of this province that gets really left in the shadow of Vancouver. And so I do find that in our little community here. We live in this very rural community, and you know, our drug supply kind of just follows along, but it'll stay, right? Like, so we follow along what happens in Vancouver. What we see there usually springs up here about a week later, but then it takes longer to cycle through because we're in a little, you know, isolated and, you know, insular kind of community. So what comes here, even if it's deadly, even if we know it's 90% fentanyl and dropping people, or carfentanil, or any analog that's, you know, has benzos mixed in, or whatever deadly thing is happening, if it's all that we have, that's what people are going to use. And they don't have other options because we are in a tight, small little rural community. Same goes for any community that's ferry access or just far away from other towns. The fact that the supply ended up tainted, it means that in little communities like this, we just don't have the access to options. I did find that's what happened in the city as well. Just all the access dried up, but it just, yeah, how the community responds is a complex question, right? Because I don't really think that, like, the drug user community responded by dying. The community of care providers and government representatives and neighbors responded by, you know, further stigmatizing and throwing some people in hotels and then ignoring their safety. And that's basically how they responded, with all of us kind of jumping up and down and waving flags and saying, we're going to die, this is going to kill us, we're not safe here, and then watching very little roll out to actually protect people.
Great, thank you. Kyle, did you wanted to add anything? Same question.
Well, here in Thunder Bay, it's very, very opposite than BC. We get an extremely tainted drug supply coming from, you know, the bottom part of Ontario, Winnipeg, Ottawa. You know, it touches so many hands before it gets here. And I believe, like, it's continually changing so fast, right? Definitely with Thunder Bay, you have a lot of the gangs, and there's so much cut being put into it. It's super hard to kind of get a pulse on it, because the moment we get a pulse, all of a sudden it's changing so fast again. And, you know, I look at the officials here and sort of the support they do, and it's the same as everywhere. It's like, well, just hand out more naloxone, just push more naloxone, you know, and that's just what they want to do, is push, right? Let's push more naloxone. There's, you know, yes, there's us outreach workers out there. A lot of us are peers. We understand it a lot more, and we understand that we need to be doing a lot more than just pushing naloxone. You know, it'd be nice, you know, it'd be nice to not have to give out naloxone, right? A safe supply would be a safe supply. You know, that's where I think everybody needs to focus so much more than just handing out naloxone and continually just band-aiding a pandemic, because that's what it is, right? All this money went into this pandemic that it was acceptable, but the one that was unacceptable just got swept under the rug, I feel like, even farther than it already was.
Thank you. Alfeder, you had something to add?
Yeah, I did. I just wanted to add too that listening to Kyle talking about how the substances are just being more and more cut, I do find that we haven't really made drug checking equally accessible across the province here. And I don't even, in the rest of Canada, it's even worse. I know that it is. But, you know, we have seen a real uptick in atypical overdose response, and not a lot of information going out to outreach workers and overdose response workers about how to respond to atypical overdoses. So we're still seeing quite a lot of people dying because they just didn't fit the bill of how people were originally trained to respond to overdose. So, you know, now that we have quite a lot of benzodiazepines mixed in, it's causing a whole different reaction. And Narcan doesn't necessarily help for a lot of those responses. And if people see people moving around or, you know, with rigidity and stuff, if they're not unconscious, they've been trained that Narcan and naloxone are only for people that are unresponsive. So if they don't look unresponsive, they don't necessarily get naloxone. And, you know, with more stimulants being more deadly, it's just really, it's just taken an already deadly situation for drug users and increased it tenfold. So now it's everyone and pretty much every substance. You can't always check it, yet we're having this like check your drugs message screamed at us, but we don't have access to the machines or even the strips for testing. And you know, it's just leaving people in this deadly vulnerable situation. And like I keep saying, preventable, completely preventable. But just more information about atypical overdose response is so needed for folks, because it's a big one in the province right now here.
That is very true. Thank you so much. Yes, Kyle?
Yeah, I just wanted to like agree with the check your drugs. And like I know here in Thunder Bay, we have a strip and all it does is check it for fentanyl. That's all it's checking it for. And it's no news flash to everybody that there's fentanyl in it. And I think that's kind of the duh of it all. But it's like, what else is in it? How do we get that checked? How do we get that rapidly checked? You know, and I think that's another one of the major concerns is, you know, the government wants to roll out that, oh, we're, you know, they're pushing that check your drugs, but they're not giving us enough to check the drugs. You know, one strip testing for fentanyl, most people can tell you there's going to be fentanyl in most of what they're using, but it's what else is in the benzos, et cetera, right?
Yeah, if we can see communities instantly rally so that, like, I know my tiny little town here almost immediately had a pandemic response of a group of physicians. They had a respiratory distress or support clinic set up. It's open every day. The hospital was kind of like renovated to be COVID safe. We had staff hired. We brought in experts. And that's just my little town. When I look at the response across the province and across the country, I just can't help think, like, how come that infrastructure was immediately available, but we can't give out FTIR machines to the various health authorities to make sure that they're at least accessible in various communities? Drugs can get tracked to a degree. You know, to a degree, you can follow the color and shape and track it across the province and warn people about, if you can warn people of how exact many people tested positive for COVID and their exact, you know, stability and how they're doing with the disease, and we know all of that, why can't we just say to drug users, your community right now is at risk, and let them know to be more diligent with the harm reduction protocols that we've encouraged, because they're useless unless you actually can deliver it, right? And we know that you can deliver messaging now. We know that. We've watched them do it. So it's just deeply frustrating that we're not seeing the upscale of harm reduction. It's very disappointing.
Yes. And that really brings me back to what you said a little bit earlier about the 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 importance and the value of people's life, and the way we're treating the lives of drug user and the lives of people who have COVID. Someone in the Q&A asked, how can we all become more proactive as participants and supporters? And I think personally, one of the things we can do is make sure to erase the stigma that is surrounding drug use. I think that if there would be less stigma, that would definitely be easier to put resources towards helping, you know, stopping the overdose. Like everyone said, we have the resource, we have the money, we have the people. We're just not putting it towards this pandemic because we don't value the lives of people dying in this pandemic. So that would be my answer to that question. But if you want to jump in, how do you think that people can be more proactive as participants and supporters?
I don't mind. I don't want to monopolize. If I think Rosalie might even have her hand up there.
Oh, I can see the hand. Of course, Rosalie. How do you think
Oh,
people could be more proactive as participants or help more?
I think maybe like being vocal, I guess calling the elected officials, that the people that we put on, you know, on the Senate to take decisions for us. I guess that would be nice. You know, as some of you said, this pandemic was kind of treated, you know, and it's nice to know that in other places in Canada, resources were given for this pandemic, but in Quebec, nursing home were abandoned by employees because they didn't have the proper equipment. People were left to die, or you know, or oldest people were left to die. Some of them were found and they hadn't like had a drink of water in days. So our health system here is really, really, really broken. So that's the thing here. Sex workers, homeless people, that by the way doubled in Montreal. We passed from 3,000 people to around 6,000 people. Many people are at the intersection of homelessness, drug use, and sex work. We're pretty much at the end of the list, you know, because they try to hire health workers, but the system is so broken that people try and they burn out instantly. We have a doctor that was on the news that she committed suicide because the crisis is just, it's too much. So our pandemic is erased by the COVID one, and the COVID one isn't even handled properly. You know, with the curfew, our prime minister here said that the homeless people had to respect it too at first, and said that anybody could pass as a homeless person just to go out, which is incredibly stupid. And we had to have like a judge to overturn this decision because he would not, you know, let homeless people alone, you know. And we had an indigenous man die in a chemical toilet. I don't know how to say it in English, but you know, he died in the cold because of those laws. So yeah, that's it. That's what I want to say.
Thank you. We have another question asking, how do we get safe supplies rolled out in a place that are user friendly to people who use drug, since we know that going to the doctor doesn't work and we have massive shortage of doctor in BC. A person also say, I have a meeting with MMHA, 5 minutes to speak on what could have saved my son life. Safe supply would have saved them. So yes, how do we get safe supply rolled out in places that are user friendly?
I did want to say too, I'm so sorry for the loss of your son. MMHA is the Ministry of Mental Health and Addiction in British Columbia, and I believe it's an absolute puppet show. That's my personal perspective. I know it's not a shared one, but to me, it was just a way to appease voters. I don't really see them doing anything as far as I'm concerned. I just think it's a solution that makes people happy, but I don't actually think that they really accomplish anything. When it comes to actually having safe supply, really, rolled out, there's so many barriers to accessing care when you're a substance user, and very, very little to zero education was done to get doctors and prescribers, which include nurses in British Columbia, up to, current, ideologies and knowledge around evidence-based models of care that are harm reduction based. We still have a lot of care providers that have very archaic views that are still very abstinence based. And some of the biggest things, and the walls that we're up against, in my opinion, in British Columbia are the colleges. The College of Physicians and Surgeons here, the College of Pharmacists, it's the colleges that aren't doing anything to ensure that it's mandatory that drug users are treated with dignity and that we're treated equally and that we have access to healthcare. There's so few things in the world where you can walk in and say, this is my healthcare need, and a doctor can say, well, it challenges me ethically that you have this healthcare need, so I'm just going to leave you high and dry. That's not how we're supposed to see medicine practiced, but it is how it's practiced here, and there's no oversight. We don't have any support from the colleges, and we still have colleges wrapping doctors' hands for overprescribing. And that caused such an increase in risk in British Columbia when we had people that already had safe supply because they had their meds, and they maybe even were good with the amount they had and they were content. And then the doctors decided they had too much and ripped them away because stigma says drug use is wrong. And, so I really think that advocating to ensure that we have mandatory, education around substance use. They increased how many people can prescribe in BC by giving, access to all doctors. So you don't have to be like a specialist to prescribe like methadone or Suboxone anymore. And it didn't really affect the numbers. And then they added nurse practitioners, and it didn't really affect the numbers because very, very little training went into supporting these new policies. So, you could still walk into a doctor and say, I need you to prescribe me morphine, and they could laugh you out of the room, right? Which means you're not going to go again, and you're not going to try again. And it just leaves you in such a vulnerable position. If you have 5 minutes with a minister or with the MMHA to talk, I don't even know if you could jam it into 5 minutes, but I would say that there needs to be some mandatory education for the colleges. There needs to be policies that are universal. We can't have mystery around our healthcare. We need to know what our rights are and know that they're being respected, and that we have equity when it comes to our healthcare. So I think that pressure for the colleges is big, and mandatory education for care providers is big. When it comes right down to it, nothing matters when we're criminalized. It's such a hypocrisy to allow prescribing for safe supply if we're still criminalized. It's bullshit. If I can shoot up with a prescription now and I'm legally doing it, but the person beside me is illegal because they're shooting up a different substance, yet they're at greater risk of death and they have more barriers to care, that's just ludicrous to me, right? You can't fight stigma when you're criminalized. You can't really roll out safe supply properly when you're criminalized. None of this stuff matters when we're criminalized, right? We know now that you don't really, people push it back and forth. The BC government says we can't do it because the feds won't let us. The feds say we're willing, it's the BC government. And that's something you can bring up to the MMHA too if you want. I know 5 minutes doesn't really give you enough, but there's ways people can promote decrim in smaller governments. Even municipal governments can tell their police not to come down. There's ways, and what we're doing is not working, so it's time to look for other ways, right? We have to do something.
Thank you so much. And while I have you, someone was wondering, how did you protect yourself from legal persecution when you were offering safe supply openly?
The cops just stood right there. If we were arrested, if anyone I should say anyone was arrested providing safe supply, it would certainly make for an interesting court case. And I think all the participants know that and accept the risk that, you know, that it would be a welcome dialogue in the courts. And otherwise, you know, I think that we're hoping that at least there's recognition that it's a life-saving measure, and that, you know, the police coming down on us, it's unethical. So who knows what will happen to folks on April 14th. But, you know, the message is this is possible, and, you know, that we need to protect ourselves. And the police arresting someone for protecting their own community would certainly be a big statement. And it would tell us all a lot about people's priorities.
Thank you so much. Someone is wondering, they are not hearing much on legally regulating drugs. How come just because we're all told that it's problematic, dealing with different levels of government? Kyle, would you have anything to add about that?
I don't have a lot to add about that. I think that if they started to legalize drugs and go that route, they'll have to admit that everything they've done up to this point was wrong. And I think there's been models all over the world that has proven what it can do and how it can help the communities. And but yeah, I don't have a ton to say that. I was hoping Hawkfeather would.
When we say safe supply, we're talking about legally regulated drugs. So anytime that we're saying you're hearing the term safe supply, that's really what we're talking about. Right now in BC, they have dual risk mitigation guidelines that allowed for the prescribing of some morphine, some hydromorphone, which is dilaudid, some stimulants, but most of the drug using community agrees that that's not really safe supply. That's more replacement therapy. Safe supply would be heroin, it would be fentanyl, it would be methamphetamines, and it would be cocaine. And it would be free of fentanyl and measured and available. But yeah, when it comes to legally regulating drugs, I watched them roll out this, you know, preliminary policy paper on the dual risk mitigation, and I just see so much room for improvement. But that's great, right? That we had a little model we could look at, and that gives us a lot of information on how to do it better. And I believe new papers are coming. I think some new policies are being written around safe supply in British Columbia. And aside from that, the reason we don't have decrim and we don't have safe supply is because our government is chicken shit, really. There's no other way to put it. We do not have brave leadership. We see people that are more afraid of losing votes than they are afraid of losing lives. And that's the only reason that the government is not aggressively working to prevent the deaths of drug users. So I really just think it comes down to ethics. We have some very immoral leadership in Canada that has kind of washed their hands of the lives of substance users and left us to fend for ourselves. So again, I'm saying just get the fuck out of our way then. It's been clear 5 years in, they're not going to do anything. So we'll figure it out and just make it so we can, right? That's the way it has to be, I guess.
Thank you so much.
Also, I just wanted to say too, someone just added safe supply is so medicalized. It's true. Medicalized models of care don't really count as safe supply when it comes to my perspective. There's a lot of ritual when it comes to substance use. There's a lot of community amongst drug users, and supporting peer-based, I don't like the term peer, but peer-based models of care, that's safe supply, in my opinion. In British Columbia, there was a heroin compassion club, and it worked beautifully to save lives. And the members of that club, which I was one, were allowed to access the medicine that they needed to be well and whole in life, and do it with the support of loving peers. And, you know, it would be great, but we're in the midst of a devastating crisis. And even that wasn't sustainable because, you know, we can only hand out drugs or provide compassion clubs or any of it if we have some access to safe supply that's out there in the world, right? Yeah, this is all of it. Even the Dolph actions, it's all compassion club model. It's the model of substance users taking care of themselves, and it happened with cannabis, and it was very successful and led the way for a lot of policy change. And we're kind of hoping that that's the path that we're on now for you know, illicit substances.
Right. Thank you. Rosalie, coming back to you, do you have any last 2 words you would like to share with us?
Like I just wrote in there was some messages that I was seeing in the chat of the Zoom meeting. What we can ask for to help sex workers right now is to decriminalize, not legalize, because we don't want to have the government, you know, regulating what we do with what's inside of our legs. You know, we want it to be free of any laws, you know, and it's been proven in many places in the world to help prevent and limit human trafficking, contrary to popular belief. So that's what I would have to say.
Great, thank you so much. Kyle, same question to you. Any last 2 words?
It's just really simple. It's educate yourself. People always have such, I find, strong opinions in the world, especially around overdoses and drugs and all that. But they speak out of opinion of what the media tells them. They don't actually do the educating and learn. And you know what? Stop listening to everything you see on TV, and actually do some actual, you know, learn about what they're speaking about. And don't just be a pawn. You know, there's so many people in this world that are just pawns, and they just you know, they turn the TV on, or they look at the newspaper, or look over the fence at the Joneses next door and just jump on their opinions, but they don't form their own opinion, and they don't educate themselves before opening their mouths and speaking. And yeah, so it would just be for people to actually educate themselves.
That's great, thank you. Yes, Shay.
I'm wondering, there's sort of a time where I know we still have about half an hour of this event, but are you okay if I launch the poll right now? For those who don't know about the poll, it's like checkbox, super easy to answer. It's about 4 questions long. And maybe while I do that, did you want to talk about upcoming events, Frankie?
Oh,
Do you have
yes.
those close? Okay.
Should we just hear from Ogfeder first, and then?
Yes, of course. I was just thinking we have lots of time for more questions, right? Because we go till the hour, not the half hour.
Oh, all right. Awesome. All right. So I will let everyone fill out the poll. When it comes to our upcoming event, we have the International Transgender Day of Visibility, which is on March 31. The Substance Regulation, People at Heart of Solutions, Quebec's 34th Annual Harm Reduction Conferences. This is going to be held online on April 15 and April 22nd from 1 p.m. to 5 p.m. Eastern. I will be there and presenting some great things, so I would love to see y'all. We also have the International Harm Reduction Day on May 7th. The stimulus webinar, Harm Reduction and the Range of Treatment on April 8th. Stimulus webinar, Harm Reduction in Prisons on April 22nd. And finally, the hashtag Stimulus Connect in May. that will be on stimulants.
Awesome. I actually think that we have that Santana can pull you the link. We can put it into the chat box so that if you're interested in registering for the 31st annual Quebec Harm Reduction Conference, you still can. Frankie, I am excited that you're going to be there. I also am moderating so our Stimulus Connect on prisons is actually in the Harm Reduction Conference.
Oh.
So it's a great collaboration. So it's like, please go to this, but also we're going to be there. And so it's nice to sort of do our event in that event. And yeah, it's a great partnership. If you can, I'm going to leave the poll open for a little while, just so that people can answer it. And if there's more questions, or you were going to throw to Hawk Feather, as you were, I just didn't want you to stop because we still have 26 minutes of chatting about this important topic.
Oh, that's awesome. All right then. So we'll check Q&A. Do we have more questions? If not, I actually have questions for everybody, so that's not a problem. So Rosalie, for people who work as a sex worker, well, I feel like you did already touch about this a little bit, but still, what would you say has been the worst and the best about the pandemic?
Oh, the best, I guess, was the Canada emergency response benefit checks to people because they used it to call us. So that was nice, I guess. But the worst thing was in Quebec, the curfew. And I guess overall in Canada, we don't really have any news about the vaccine. We're nowhere in priorities, although we still are much more at risk than other people.
And do you think that the negative impact of the pandemic is going to be an asset for advocates in pushing for decriminalization, like you were mentioning earlier?
I hope so, because with people that are fighting to criminalize the sex work, abolitionists, I think it can be used both ways. You know, some of them were trying to push the narrative that some of us were actually trying to get out of the industry, so that we need more programs to help us to save us, in quotation mark. We don't need to be saved, we need rights. So yes, I hope that we can use it to represent our reality, that yes, decriminalization would have helped in this case, as for example, New Zealand, sex workers did receive emergency response benefits because sex work is recognized as a real job and it's decriminalized over there. So
Thank you so much. Also, Alkfeder, I had a question for you. How can we best support substance user and frontline worker such as yourself who are burning out from responding to overdose?
That's a really complicated one. I know that here in BC, with the increase in advocating to have peer workers, and it's become more common and more encouraged to do peer engagement in this work. With that comes a lot of advice from higher ups about how to do our work, work that has been done for all of history, and it often comes from a real place of privilege, and with not a lot of understanding about what it means to be a peer worker. It's like having someone scream self-care at you when you're in a burning building. We had trauma response team come and talk to our little outreach team here where I live. And they gave us this like spiel. They had like a spiel about self-care and how you had to have boundaries. The example they gave was if you were at a cafe, an outdoor cafe with your partner, and one of your clients, they called, came up and started bothering you, you had to be able to encourage them to recognize that you were not working right now, and that meant you were not available. And we laughed. Like, do you understand what peer means? It means that we're doing this work because we are this work. You can't turn off being a drug user at the end of the day when you go home. You're still a drug user. Your friends are still dying that night. You're still in the midst of it. You're still at risk of death yourself. You're still caught up in complete trauma, and people need support all day, every day. And the advice that we're given is just ridiculous. So when it comes to how to best support people, it comes from listening better to those of us that are substance users and doing this work. Having actual benefits would make a massive difference. Being seen as actual employees and changing policies. A lot of the reason we end up contractors is because a lot of businesses have policies against substance use on the job. And, you know, there's still a lot of really archaic language, and, you know, it's still not inclusive for substance users. So we get a lot of positions that are contracted out. We get shit pay. We get replaced by people that don't have lived experience, but then make triple what we made. We come in and create the platforms for things and then are exploited or tokenized and left on the wayside. And we're the experts. So when it comes to helping us, it means listening and actually letting us dictate what our needs are, paying us in an equitable way, allowing us to have benefits so that we can get counseling if we need it, and our supports are in place and can be paid for. But yeah, that's basically it. It's listening and giving us resources, right? That's really what you do.
Thank you so much. Kyle, same question. How can we best support a substance user?
You know, almost everything Hawkfeather just said I can relate to so much. You know, one of the meanings of peer is equal, but yet we're not treated equal. If you look into it, like the wages that we make, you know, somebody goes to school for 10 years to become a doctor, they make $250,000 a year. We spend 10, 20, 30 years on the streets or involved in drugs, but we're just looked at it as a peer for $20 an hour. And so where is the equality, right? And I can totally relate when you're out in public or whatever, and you have, you know, one of the people that you work with, not a client, but someone that you work with, come up to you. Like, I know that a lot of organizations they want you to put that boundary up. And for me, that there's no such thing. I can't have that boundary up. My boundary could cost somebody their life, right? There's no such thing as that boundary. And that goes back to meeting people at where they're at, literally at that moment. If that's where they're at is the same coffee shop that I'm sitting in, then I'm there. And it doesn't matter if I'm clocked out after 9 to 5 or they're calling me on my personal cell phone. I love that one too. We'll give you a work phone that these people can call you, but don't answer it after 5 o'clock at night. That doesn't exist. You're either there or you're not. And I believe that if you make that choice to be there, you know, I tell all the people I work with, like, you can call me anytime, day or night. Like, drug use doesn't stop, you know. That life, that need for help, that need for acceptance, that need for any of that, that's a 24-hour a day, 365, 7 days a week. Like, that doesn't stop. And so often that she said it, Hawkfeather, sorry, he said it absolutely perfect when they said that, I totally lost my train of thought here. Just that it doesn't stop, and we need to be available. And when they pull us out of these jobs and they put somebody into my job that has 2 years in schooling, they make so much more money, like instant, like here's a $10 an hour raise, but they have no experience with the direct experience that we've had for 10 or 20 years. And it's consistent, right? Through this epidemic, it was very interesting to me that the people that were doing the same job as me in different roles with different companies that I was working for, but they just had an education. When COVID hit, they took time off. They were gone for 6 months. So here I was trying to do, pick up extra shifts because we don't make as much money. So of course we need 2 or 3 jobs. And at least they were finally available that I could get those shifts because all the educated people, COVID hit, so they were gone, right? They were gone with the wind, on vacation, time off, whatever, because of COVID, right? For me, it was, okay, now I'm working 3 times as much. And, my fiance and kid, it's like, okay, I might see you once a month because I don't feel safe coming around you because, all the warnings with COVID and all that, right? And then you're driving down the road worried that you're going to get pulled over because they have some order that you're not supposed to be out of your house. And, I'm past my working hours. So how do I explain why I'm out at midnight besides trying to help one of the people I work with because they're having a problem? The work that we do, it doesn't end. There's no expiry date. There's no hours. It's, you know what I mean? You sleep when you can, you eat when you can. But if one of those people we work with messages me at any of those times, you be available, because drugs don't stop and neither should we. Thanks.
Thank you so much. Someone says, I find that being a peer worker, people think I'm too close to work or too traumatized to be able to do it. How would you respond to this?
I can speak to that. I feel like people are afraid of what they don't know and what they don't understand. And a lot of the barriers to care and a lot of the stigma that exists around substance use comes from that fear. And I find people try in all sorts of ways to other us. And that includes placing limitations on us based on perceptions of our level of trauma or our ability to cope. We are a very underestimated group of people. People see drug users as lazy and immoral and not very intelligent, but you have to be brilliant to be a drug user. You have to hustle, you have to be resilient and loyal, and you have to be strong as hell. And I really think that people just don't think we're capable. They really don't. And it's just an uncomfortable truth that we have to exist in a reality of constant trauma and grief. And some people don't like facing that reality, but it's just a truth. It's a truth whether you're a peer worker or not, that if you're a drug user, you are surrounded by grief and trauma every day. And it's just very uncomfortable for people to understand that. And if you're a peer worker, it can be a little bit hard for people to understand why you would choose to put yourself out there and face that level of trauma. But I think it's because they don't understand that you're experiencing that trauma either way. And it's very healing to feel like you're helping. It's very empowering to give yourself permission to see yourself as powerful and strong. And we most of us thought we were pieces of shit for decades. And it's peer work is like giving yourself permission to see yourself as amazing and to see your previous weaknesses as now you see them as strengths, right? Like it's a really great opportunity. But I don't think people see that outside of being substance users or peer workers. I don't think they see the community spirit and the way it lifts us up. It's traumatizing as hell, but it is so rewarding too. And I tell you, I think it balances out pretty great, really. It balances out wonderfully to me. I wouldn't walk away for $1 million, right? Like yeah, it's traumatizing, but that's why I'm here, right? But it's hard for people to understand.
Thank you so much, Peter. And I think what you just said is really, really great and important because we talk a lot about the trauma and the issues and the death and how difficult it is, but I feel like we don't focus enough on the positive and the joy and what can be beautiful about that job and about being a peer worker. If you or Kyle or Rosalie, I would like to hear about actually what you enjoy about being a peer worker or a drug user or sex worker, because I think it's important to not just only speak about the sad things, but also what brings us joy.
For me, like being a peer worker was, I spent 20 years involved in drugs and the street life, and being a peer worker was finally a job that I felt accepted and like I felt like I understood. Um, Instead of always looking at the world and not understanding because I don't have an education or I don't know how to speak in the language of, of a certain demographic of people. I don't have a university degree, so I can't go for that job. Finally, I felt inside that I had a university degree for this job, that I understood this job. And the people that I was working with under every day, I understand, like I absolutely love the community that I work with, and the people that use drugs, wherever they're at, I absolutely love it. And I finally felt acceptance. And as a peer worker, it was like I could finally say, I have a job in this finally. And I felt accepted inside. And truly, I love what I do. I wake up every day and I'm excited to go to work. And I'm very fortunate, I work with a couple ladies in my job, and like they understand me. They work with me side by side, and like the three of us all share a view, and that is the view that we are always there with our hands up. It doesn't matter the time of the day or if we're at the mall with our family or whatever. If the people that we work with come up to us, we are open to help them, and we are open to do it to the absolute best of our ability.
Thank you so much for sharing your joy with me. Yes, I'll better.
I just raised my hand because I'm a bit conscious that I'm taking up more time than the others. I just wanted to say, I feel like there's still this unspoken expectation that anyone openly discussing substance use or being a substance user is striving for recovery, and recovery means abstinence still. And I think that that is a really challenging aspect of our work. There's still a lot of assumption that even within, there's this internalized stigma that's just absolutely, it's a heavy weight. And there's still quite a lot of assumption that we will be seen as valuable, and we will seen as worthy of inclusion and worthy of having our lives saved if we're striving to no longer be drug users. And those of us that are active drug users and embrace it and see it as a beautiful part of our lives that do not need to reject it. If there's a million paths out there, and for some people it's abstinence, but there's a lot of us that are just desperately trying to be heard. And when it comes to being hired, when it comes to who gets chosen to be very vocal advocates, they're often the people that have the raw recovery story. We see a lot of, shots of people at a park with their beautiful family saying, I used to be a drug user, now look at my beautiful life. And those of us that are like, I use every day and look at my fucking beautiful life, we get a lot of backlash still. And it is really, really challenging to still try to convince people that drug use is a normal human behavior, and that you can be a beautiful person and a drug user, that a lot of the negatives we associate with being drug users come from criminalization and stigma. They are not things that come from the drugs, and they're not things that come from the drug users. And like really addressing that, that's what opens the door to change the policies and the views and the voters' views, and eventually make way for better policies. But it's really hard, because when you're talking to people and they're challenged by the work you do or the stories you share, they're still often coming from a place where they're expecting you to tell them that you are a piece of shit and you will be more worthy of human respect and dignity when you no longer use drugs. And that's just a real struggle that a lot of us are still kind of dancing around, right? And it's not easy to be out there, and especially if you're a parent, especially if you're LGBTQ, any other marginalization, any other thing that intersects, it increases your risk, it increases your vulnerability, and we're not making a lot of room for people to have their voices that are active users. And I think that that's something that's really got to change, especially in the pandemic, especially when anything comes up that makes our lives more at risk, right?
Yes, thank you. I couldn't agree more. And that's why I think it's really important to talk about also positive things related to drug use and not just the negative, so we can remember that, like you said, we can be a drug user and have a beautiful life. So yes, thank you so much. Rosalie, speaking of positive, I would love to hear what you like about your job as a sex worker.
Well, as a sex worker, what I love about my job is to communicate and connect with people. A lot of people need just some sympathy, need someone to listen to them. Some people don't get human touch. Is it maybe because their their partner died, or they just separated, or their relationship is not as physical, or they're handicapped. There's many reasons, but it's most of the time it's really from a psychological psychological reason that they ask for my presence, even if they're using drugs or alcohol. Is just wanting to not be alone, and people really want to be listened, and sometimes it's the only way they can be listened, because that they can talk about like their drug use, some sexual fantasies that they might not feel comfortable telling their friends, families, or therapists, because they're scared of stigma. They're scared of a reaction that could happen. And as also a peer worker, because in my civilian job, I actually work in a temporary homeless shelter. As Hogfeder was saying, this is something that I see also in sex work and homelessness, and also, like you said, drug use. The image that we have is that we have to get out of sex work. That I used to be a porn actress, so I used to do that, but as it's just, why do we have to get out of it? I love my job and I want to do my job. When I come back from work, I know I made at least someone smile. And I don't think everyone who has a job, I don't know, like a debt collector, can say that. So it's a privilege for me to have people letting me in their such personal and intimate space. It's a real privilege, and I enjoy that.
That's really beautiful. Thank you so much. I was also wondering, how can we ensure that the level of resources that went to COVID goes to harm reduction or substance user, for instance?
It isn't going to. It just isn't. The entire ideology of the nation would have to change, and it isn't going to. I think that we've waited for 5 years for rescue, and they're not coming. And that's an incredibly hard truth to swallow. But I really feel like a lot of the positive changes that have happened in Canada and in North America came from the hard work of people with lived and living experience. We wouldn't have insight, we wouldn't have safe consumption sites at all if drug users hadn't occupied the city hall in Vancouver. We wouldn't have needle exchanges if it weren't for substance users. We wouldn't have naloxone available if it wasn't for substance users. It's every step of harm reduction along the way came from protest and activism. And the only real way we can ensure that we will be treated with equals is to demand it, vocally demand it. And at this point, it's time for civil disobedience, and it's time for standing up and demanding better, because it's not going to happen otherwise. I think that what we're now trying to ensure is that the next generation of drug users is safe and protected, and that we can support each other in our own way while we've been abandoned by the powers that be.
Right, thank you so much. Cal, did you have anything to add about that?
I don't really have a lot to add on that. It's a little beyond kind of my vocabulary.
That's fine. Do we have any other questions from the participants for our panelists? If not, I was also wondering if any of you noticed an increase in the overdose number since the pandemic began.
It's been an increase the entire time. And that's, I guess, for me, and I'll just speak really briefly on it, that's one of my biggest frustrations, is that in the beginning, they made the increase public, and it seemed to go like that for a couple months, and then it got swept right under the rug, and they just put the pandemic right over top. And I still believe in Canada, and this is it's not concrete, but there's been more overdose deaths than there have been COVID deaths in Canada, as far as I know. And yet it's swept under the carpet.
Yes, Shay?
Oh, so it's sort of an interrupt to the question, so bear with me, but I was wanting to know, is it okay now? Is now a good time to share the results of the poll?
Oh, yes.
We had about 49 people who are answering it. So it should be up in your screens, and you can just scroll down to see. And so happy to see that there's some great diversity. And there was, yeah, it looks like 9% of the participants were bilingual. Yeah, I wanted to thank everybody for doing that. It gives an idea of who's in the room, which is, helps us with funder questions. So,
Shay, I'd also like to say too that looking at that poll, it really reflects what I find for work in Canada when it comes to peer work and activism. There's desperate need for support in the territories and in Saskatchewan. And those are places that are still ridiculously behind when it comes to harm reduction policies. They don't even have needle exchanges in a lot of areas. let alone safe consumption sites. And I think it's interesting to see how much that poll just reflected, services across the country.
Mm-hmm. It's interesting as I go forward and do national work, so Saskatchewan's interesting, and I think the prairies were interesting. One of the, if we have funding, we're actually planning on holding a mini event, calling them stimulus meets, where we actually bring the prairies together. So Manitoba, Saskatchewan, Alberta, but actually probably hold it in Saskatchewan, and there may be some strategy about which community that is. Wouldn't just assume that it would go hang out with Prairie HR and Jason in Saskatoon, but maybe we should be in Regina, or maybe we should be in one of the others. The trick that, our stimulus meets for the year after, one of them is north of 60, and having conversations. Initially we were thinking bringing people together, and just having some conversations all in one place. And their response was like, no, we need you to bring the people to us, because to bring us down, we'll have less impact than if we go up. And so it looks like something a bit bigger, but for sure, with the territories, they only have about 40,000 people in each one of them. So it's also really like everybody's doing a lot of jobs, and isolation is an entirely tricky thing. And COVID for them has really shown us, or shown the rest of Canada, that their internet access has always been bad, but their ability to even attend something like this is actually, their internet's a barrier, because the video takes so much Wi-Fi time space, and they actually can't afford it because it's all very metered connections. I'll wander off on any topic at all, Frankie and Hawkfeather. Thank you for mentioning that. It's crazy. I'm gonna stop sharing the poll. We're a little bit over time, but it's about the same level of overtime we were, Frankie, with the beginning, trying to work on getting Hawkfeather's translation up and running, and we managed to muddle through without it. I think not too bad. Frankie, you have some closing words? Is now the time for that? Did I interrupt?
Well, yeah, I still hadn't time to let Hawkfeather say any last word for us.
Boy, last words. I'd honestly, I feel like reflecting on the beauty of the drug user community is the most substantial thing we can do, because it's just should be unnecessary, but it is a necessary reminder that we deserve to be treated with equity, and we deserve to stay alive. And that is not measured by our sobriety or our potential for sobriety. I tell people, my life isn't great despite being a drug user. It's really great because I'm a drug user. It gives me the tools that I need to survive, and not just survive, but thrive. I have a beautiful family, and I'm really grateful for what I do have. And that includes my identity as a drug user. And I think that the more we encourage people around us to change their perception of what it means to be a drug user, the more we open our arms to embrace that this is a community of people that is at severe, severe risk and desperately needs the support of our neighbors and friends and family. So stepping up the allyship and supporting each other, we keep six, we watch each other's back, and we are here in solidarity for each other. And I think that that's always a nice way to wrap up things. It's a painful topic in dialogue, and ending it with a note of solidarity and cohesion is really beautiful to me. I'm always grateful when I meet my comrades from across the country. It feels good. And thanks for the opportunity to come and meet some folks and speak.
Well, thank you so much. And thank you, Kyle and Rosalie. It was really, really great to hear you all. And thank you everyone for attending, for everyone's engagement. I don't know how the weather is everywhere, but it's beautiful and sunny here. So we really appreciate that you took some of your time today to attend, to learn, to speak with us. Um, so Shay will be sending you a follow-up email that includes a link to the evaluation survey, sorry, to collect your feedback so we can improve future engagements. The link to the website that will include today's recording as well as the previous and new resources. So yes, thank you so much, Sophie, for this simultaneous interpretation. Um, it's really appreciated. A big thank you to the team behind the scene who's helping, including the folks from Stimulus National Implementation and Planning Committee, Natasha from CAPUD, Donna from the CDPC, and Julie Soleil from IDQ. And I will end it to Shay for one last word.
The one last word is thank you for moderating us chickens, or kittens, I think we are today, wrangling us cats and getting us all in one place and creating and holding this space. It's been really wonderful. And I thank you for doing that. If it's okay with everyone, I'm going to turn off the recordings and we'll go from there.